In the lordotic posture, we mentioned that the pelvis is anteriorly tilted, and as it tilts forward, there will be lengthening of the abdominal muscles and the gluteal muscles and shortening to the lower back and the hip flexors. Now, whether that's permanent or whether that's temporary, we can modify symptoms by addressing this muscle imbalance. And with these two exercises, we're going to look at two movements to stretch out the hip flexor muscles. And if you remember, the hip flexors are both the rectus femoris and the iliopsoas. So the iliopsoas is only going over the hip, while the rectus femoris also passes over the knee. So we need stretches which will both address the hip and the knee. And the first stretch we do is a modification of the Thomas test that we did in our evaluation of hip flexor tightness, but used now to address the tightness by using a stretching exercise. So let me just give a quick demonstration. So what we do is lie down flat, and I'm going to keep this leg flat on the floor while I draw this leg upwards. So as I'm moving my left leg into flexion, my right hip flexors are placed on stretch, although I've taken this stretch away from the rectus femoris by keeping the leg straight. And if you find that that is very tight and your leg comes off the floor, then it's often easier to draw the left leg up with the right leg bent and then slowly slide the leg forwards until it's straight. So that's our first stretch, and we would do that on both sides. Our second stretch is a hip flexor stretch with the knee bent, and for this we can have a chair handy if you need the chair for balance. And then what I'm going to do is I'm going to stretch my right hip flexors by stepping forward with my left leg. So my knee is flexed to 90 degrees, my hip is in neutral. I'm going to just tighten my abdominal muscles slightly and drive my pelvis forward so I feel the stretch down the front of the hip flexors here. Now, if I don't do that, if I don't engage my abdominals, what can sometimes happen is that as I go forwards, I hyperextend, so the lumbar spine comes here. So by tightening my abdominal muscles slightly as I put that stretch on, the stretch then comes away from the lumbar spine onto the hip flexor. So I'm stretching down here, and as I release, that stretch can also be modified slightly so we get a little bit of an effect on the iliotibial band. So if I now come round to face the front and put that same stretch on, I'm coming forwards into this position with the standard stretch. But what I can also do is draw my foot across so that as I go forwards, I'm also drawing this back right leg into an adducted position. And I can creep this foot right forward so I've gone back into extension and come across into adduction. And if I'm finding that difficult to maintain the pelvis, I can put a side flex and stretch on as well, and that just takes me across to lengthen the side of the body. So that addresses then the hip flexor muscle tightness, and we're not looking to permanently lengthen those hip flexor muscles. All we're doing is changing their tone slightly to modify patients' symptoms.